Hi, Marika.
Hello,
Hi.
hello.
I would like to know more about microscopy. So how can we do? There are alternatives for light sheet microscopy. Can I go to other microscope and use this
For
systems?
clear tissue,
For
right?
clear tissues.
Yeah. This is a very good question because not all of the institute have the light sheet microscope, but I'm pretty sure that at least 90% of the universities and institute, research institutes in the world have at least a confocal microscope or a two-photon microscope, which are much more common. And it's important to understand how we can use these other machines to image cleared tissue, because there are some tricks and there are some things that we have to take care and then take in consideration.
Such as?
For example, the sample mounting, the objectives that you should use, some tricks that you can use in the software, especially when you have to image deep and very thick tissues, and what are the best suitable tissue for this.
Okay.
Yeah.
Can you explain me briefly, like, what are the advantages of confocal / two-photon microscope over light sheet microscopy?
Yeah, sure. Of course, when you want to image with a better resolution, so you want to catch very fine details, you can go with the confocal and two-photon. They are known to have a better resolution rather than light sheet. But of course, one of the drawbacks is that they can bleach the sample more and they are slower. And it might be that this means that you have to take a lot of time to get the same information.
That depends on the sample size as well.
Exactly. If we have an inverted microscope where the objective is coming from bottom to top, so they are going like this to image your sample, then we come up with a quite simple solution. So these are glass bottom dishes. You can see that is a Petri dish made of plastic, and in the middle there is a cover slip made of glass. And in this way, you can put your sample exactly in the middle where the bulb is, so it will not melt the plastic. And you can just
have to be very careful when putting the PAB.
And then later you can just simply go to the microscope. So how does it work? I can show you. In this case, we have a quite big sample, which is the whole brain.
That's nice.
And then what I'm going to do is to put the whole brain in the middle, like this. And then it's important that the surface that is touching the imaging part has bulb, so you can put like drops like this. Okay.
How much would you, just a few drops?
Yeah, a few drops, because in this case the brain is quite big. So you cannot really cover it completely, because otherwise you will melt the plastic around. But then if you're interested in imaging the cortex, then this is absolutely fine. And then you just go like this to the microscope. I will show you later. In the case that you have small samples, which are ideal for confocal microscopy, because you can image the whole small sample, for example, a whole organ as entire, like a very big overview in high resolution, then it's even easier, because you see here in the middle we have a tiny adrenal gland, and it's fitting exactly in the middle of the cover slip, and then we have a drop of bulb to cover it. So in this way, the sample will be always immersed in bulb, and because bulb has a very, it doesn't evaporate so fast, then you can even keep it for several days and it will not evaporate. It's absolutely fine for your imaging. Okay, so the other way of mounting that is a little bit more tricky and you have to be more careful is to have a glass like this. This is normal histology glass. And then you have to design a pool to put your sample in and to cover it with bulb to keep it transparent. And then in the end, you have to seal your pool with a cover slip, like normal histology. But because now you have a thick sample, then of course you have to create like a wall here to have volume, right? So this is more tricky because you have to be 100% sure that there is no bulb coming out, no leakage. And we come up with a solution of using silicone gel. So as I said before, the gel for to seal the bathroom, the sink. Normal gel. And then with this, there is a tip that you can put on it, like this. And from here, you can just simply draw the pool with the wall as high as possible, of course, depending on the size of your sample. And if you have a very big brain, you can even put several layers of the silicone gel, like a cake. And then in the end, you just mount it as normal, like trying to push out the bubbles. Okay?
So Marika, one more question. So what kind of specifications I would need for the confocal microscope to image my clear tissue?
Yeah, sure. So actually, practically, I think that all the confocal microscope can do the imaging of the cleared tissue, but of course you have to be careful of the objectives that you are using.
That's true.
The meaning of doing tissue clearing is actually to image very, very deep. And if you are using objective that actually has a very short working distance, then you lose the meaning of clearing, right?
Yeah.
Because in the end, you clear the tissue, but you cannot image the other side.
That's true.
This is why it would be ideal if you have a long working distance objective. Like in our microscope, we have a Leica with a 2.5 millimeter of working distance. And in this way, it can cover, for example, a small organ that has the thickness less than this 2.5 millimeter.
Okay. Perfect.
Okay, here we are at the software and we are using the confocal function to image our adrenal gland. So here I'm starting the scan of my sample, and this is what we are seeing real time. And you know that normally you can achieve a depth of 150 to 100 micrometers for confocal imaging if you have uncleared tissue. So when they are not cleared but you have sections. But now let's check how deep we can image in case of cleared tissue. So let's move to the surface of our little organ, and we start scanning here, and then we go deep inside the tissue, deep inside the organ. We reach the middle, and then you can see that the signal is still good. We just need to increase a little bit the laser power when we go more deep, or the gain. But then in the end, you can see that we reached the other side of the sample. We covered entirely. And then we set the last step here. And then you can see that we covered almost 900 micrometers.
Wow.
So the complete thickness of our sample. We can even go further, but of course it's sample dependent and also staining dependent.
Are there any tricks in the software which one should know? Like
Yes, sure. As I showed before, when you go deep, of course you have to increase the laser power and the gain because the other part of the sample is more far away from your objective. But then I think that all the softwares nowadays from all the brands of the confocal, they have this function to adjust the laser power and the gain, so the imaging parameters according to the depth of the scanning.
Okay.
So how to do this? For example, in this case, with the dye system, you can simply go to the surface again of your sample. So we're doing this fast, quickly. And it starts from here, right? When you are in your Z-stack function, you will see that you will have a correction function like here. And you can add a Z position, a Z of interest, with all the parameters of imaging required, okay? Then, what you have to do is just to move deeper, and you go until you see that you need to give more laser power or gain. So we increase here the laser power and the gain. You stop the scan, you add another Z of interest. So this Z is saved with the new settings that we put, and so on. So I can show you that even for the last one. So this is the other part. You can increase the laser power and the gain, and then you stop it. You add this as last Z of interest, and also you can set it as the last Z of scanning of your tech. This is one of the tricks that you should know for the deep tissue imaging, whole organ imaging.
This is very useful, I would say.
Yeah.
Yeah. Very nice.
And of course, other tricks can be that if your confocal can allow you, of course, you can set everything as bidirectional scanning, like here during in the acquisition mode, or even here in the tiling scan, you can set up the bidirectional. So in this way, it will scan from both sides, so you can save time, double of time.
Okay, that will be faster. Okay.
This is the final result of what I was saying. It is a combination of different tiles with the test scan. So you can see that we could cover the complete thickness of our little organ from the surface to the other side, like this. And now let's see if we zoom in. This is the resolution that we can achieve. Yeah, really. And this is done by the confocal microscope. Look.
Wow.
And in this case, you skip all the tedious and the time-consuming work of reconstructing everything from slices, and you avoid the deformation of the tissue when you are cutting it. And what we can do with this, take your data, you can use the 3D rendering software, Imaris, Amira, you can do morphological studies, the size, you can check the size of your organ, you can turn it around to see if there are differences with disease conditions, and of course you can look in 3D the architecture of your cells, and the distribution, and then quantification, analysis, counting.
That's wonderful. Yeah. Perfect. Thank you very much.